Medical professionals are discussing the fact that measles is now spreading across the United States. In response, the University of Kentucky is placing focus on learning as much as possible about the disease, talking Tuesday with specialist Dr. Nicholas Van Sickles.
And it's very contagious, and that's what really sets it apart, is that it's just so contagious, and then it can cause a lot of people to have problems afterward, like ear infections, pneumonias, things like that. And so we really want to prevent it.
There has been no documented outbreak in Kentucky, but because of the fatal nature of the disease before vaccination was developed, Sickles says people should know what symptoms to look for.
Caused about 500,000 infections in the United States. Most kids and actually most adolescents were immune to it or had it by the age of 15 before the 1960s when the measles eradication campaign started in the U.S. It typically will cause you to have fevers, chills, runny nose, cough, and then you get this rash, and that's how we typically will recognize that it's measles.
At Audiology Associates of Prestonsburg, you can live your life the way you want and find the freedom of better hearing. With 40 years of being in the hearing care industry, you'll experience patient care that is specific to you with exceptional follow-up care that ensures your hearing and balance needs are being met. Audiology Associates at 1428 North Lake Drive in Prestonsburg.
Sickles says there has been one death connected to measles in Texas, but adds most everyone born after 1971 was vaccinated with 93% protection for life.
And so the worst case outcomes are certainly death is the worst one, and we see about 1 in 1,000 people who die from measles. Most commonly it's those who are very young or adults actually as well, over the age of 20. So that's one that's most concern to us, and unfortunately this year we've had one death in the measles outbreak in Texas. The other complications and the reasons people are seeking hospital care are pneumonias, and especially for little ones, dehydration. But they can get ear infections, and even after they have the measles infection, they can, their immune systems are just a little bit not normal, and they can get more respiratory infections, more GI infections, and generally just not do as well. So in addition to just the illness, which we don't want to write off as a respiratory illness, it can really cause some severe problems afterward.
Reporting for Mountaintop News, I'm Sheldon Compton.